Joseph, thank you for being here today.
My pleasure. Thanks for having me.
So the 2020 Amygdaloid World Tour, what's the current status on that one?
Well, I don't think I really miss travel. I haven't traveled anywhere in quite a long time. I had all these things scheduled for 2020 in terms of conferences and so forth, and some amygdaloid activity with it. But everything's been canceled step by step. And it's starting to build up again, so that there are all these invitations coming for May and June, August, and we'll just have to see, because I'm not wild about getting on a test tube plane, seeing what happens. But we'll see. Maybe there'll be a vaccine, and we'll feel more comfortable about moving around in the world.
Maybe I'll make it to New York one of these days, but I would love to see you guys play live. But I guess going into the
more live music.
What's that?
I don't know what's going to happen to live music. All the little clubs in New York that we used to be able to play in have been sort of disappearing one by one, and there's maybe one or two left, and they're closed now, and nothing's happened. So. But in Amsterdam,
Amsterdam, we may be able to host you. So it's just a matter of getting you on that tube over here to potentially play. But let's see what 2021 brings.
Cool.
On another topic, which is the reason why I wanted to talk to you today, I've had this, lifelong fascination due to my own issues with anxiety. And when I start researching anxiety, of course, come across your work. So I'm really grateful for your time today. And I just want to start by just looking at the differences between anxiety and fear, because I want to make sure that we're clear on what anxiety is before we go a little bit deeper.
Okay. Well, the easiest way to describe it, and I think the most conventional scientific way, is that anxiety, let's start with fear. Fear is an experience that you're having to an immediately present stimulus, and anxiety is a worry about something that hasn't happened yet. Now, that seems pretty straightforward, but the fact is that as soon as you're in a dangerous situation, there's something threatening at your feet, say a snake or a mugger or whatever that bothers you, you have this sudden fear that's brought upon by this sudden arrival of danger. But that almost instantly turns into anxiety, about worry about what that thing is going to do, and will you be okay when it does it? Say it's a snake. Can you find a doctor? Let's say you're walking in the woods, there's a snake, it bites you. Can you find a doctor? Will he have the antidote? And on and on. So anxiety and fear are kind of conjoined twins. As soon as fear starts, it turns into anxiety. But even anxiety morphs into fear, because you start worrying about something and you see threats out there that then elicit fear in you. So it's kind of like a big happy family in a sense. It makes you very unhappy sometimes.
So let's talk about the amygdala here for a second, because we alluded to earlier your band, the Amygdaloids, but also in your book, Anxious, you talk about perhaps a misunderstanding of what we classically think of the role of the amygdala is. And so just in terms of the amygdala, do you mind just explaining sort of where it is in the brain and what we thought the role is, and now what you foresee the role of the amygdala is in terms of fear and anxiety?
Okay, just for a point of disclosure, I have a very minority view on this whole topic, but I think there's some value to it, so I'll tell you what it's about. Well, first of all, the amygdala is kind of easy to imagine where it is, because let's say you just drive an arrow through one of your eyes and an arrow through one of your ears on the same side. Where they would meet would be kind of roughly in that spot. Not exactly, but gives you a rough idea. It's kind of behind your ear and behind your eyes there. Move a little bit towards the center. Not all the way, I'm just kind of like in a little bit. It's in the part of the brain called the temporal lobe, and it's in the part of the temporal lobe called the medial temporal lobe. So if you think of the brain as like a hot dog bun, where the two pieces are together and you pull them apart, and the white untoasted part on the inside is where the medial part of the brain is, the medial cerebral cortex. So on the outside here, you have the brown toasty part. That's the newer part of the cerebral cortex, where we have our conscious thoughts and perceptions and all that good stuff. And then on the medial side are more traditionally what are thought to be older areas, but it's a little bit of a misleading thing to call those new and old. It's kind of an antiquated terminology that was carried forth from the 19th century. But I think it's better to think of those as areas that have, how shall we put it? Well, the cortical areas are in general involved in our higher cognitive processes, like even the medial areas, which used to be the part of the so-called limbic system, and thought to be like the center of emotion and all of that. Those medial areas are involved in many of our cognitive processes. There are the anterior cingulate cortex, for example, is involved in attention and cognitive control. The medial prefrontal cortex is involved in cognitive schema. Other areas over there in the medial cortex are involved in self-representation. In the hippocampus, which is part of the medial temporal lobe rather than prefrontal cortex, the medial temporal lobe, it's involved in storing our most complex cognitive memories. So the limbic system idea, which started out as a theory about emotion, is really, it was a kind of misdirection about what those so-called older areas were doing. The limbic cortex, all those medial areas, do a lot in cognition, but the limbic system theory said they were only involved in emotion, not cognition. So it's kind of like an antiquated idea, but it was a clever idea. It was very popular, and once something gets in the mind of the scientists and the minds of the public and so forth, it's very, very hard to change it. So we're stuck with this limbic system idea, which I think is wrong in terms of emotion. We can call that area of the medial cortex and areas like the amygdala and so forth that are connected with it, limbic areas, but we just don't want to call it a limbic system because it's not doing one thing like a system would do. It's not like the visual system helps you see. The limbic system, it's involved in cognition. It's got some contributions to behavioral regulation, to visceral control, a lot of stuff, but it's not really where our emotions are made per se.
Okay, so before we go a little bit deeper into this, I'm always curious how somebody like yourself, there's so many different aspects of the brain that somebody can study, but you dove quite deep and even wrote a book on anxiety. What made you interested in this?
Well, I got started, let's see, I don't know how deep to go into how I got started, but let's start with like a direct answer to your question. So in the early 1980s, in the 70s, I had been doing human research on so-called split brain patients. And we can talk about that because it's very interesting, but let's answer your question first. And the research I was doing on those patients led me to an interest in emotion and the role of cognition in emotion. So again, we can talk about that later, but that's why I turned to animal studies to study emotion, because there were no good techniques to study the human brain in 1980. So I said, well, some of these basic processes, the limbic system theory, I had no reason to question that back then. While the limbic system, like the amygdala and so forth, is supposedly involved in these emotional responses. These are very kind of primitive responses, but I viewed them as unconscious responses. So what the amygdala was doing was processing danger and controlling behavior and physiology in an unconscious way. Conscious fear, I always thought of, because of that work that I have discussed yet about the split brain patients, led me to the idea that consciousness it often involves an interpretation of the situation that we're in. And so in a dangerous situation, we consciously would experience the fear through these higher cortical areas, but we would be behaviorally controlling our responses through the amygdala and these subcortical areas of the medial cortex there that are going to generate, like freezing behavior and increases in heart rate and blood pressure. So I said, I can study these kinds of primitive behaviors like freezing and physiological changes in animals, because it's likely that those parts of the brain involved have been conserved in mammalian evolution. But if I want to study the experience of emotion, I have to study that in a human because of the cerebral cortex areas that I thought were involved would be relatively new in evolution. So I started studying rats and studying how they detect and respond to danger. Again, thinking of that as an unconscious process. In 1996, I summarized the work I'd been doing. That work had taken me to the amygdala. I didn't go looking for the amygdala. The research took me there because I started out asking, how does a sound that's paired with a shock change the value of the shock of the sound? The shock changes the value of the sound when they're associated. And then that sound goes into your ear, obviously, and goes through your auditory system and somehow goes through the brain in a way that causes the rat to freeze and its blood pressure and heart rate to increase and stress hormones to be released. So I wanted to know how that flow through the brain took place. And at the time, there were new techniques available for mapping pathways in the brains of animals. So we're able to, for example, make a lesion in those auditory areas in different groups of animals, lesion in one area, lesion in another area. And what we found was that the auditory stimulus didn't have to go all the way to the auditory cortex. And that was surprising because everybody thought the auditory cortex would be involved in any psychologically meaningful kind of auditory response. So what we found was that it had to go to the next level down, which is the auditory thalamus. And when we put these tracing chemicals in the auditory thalamus, sure enough, it went to the auditory cortex. That was expected. But it also went to the amygdala. So that told us that the auditory thalamus could connect directly with the amygdala. And so we lesioned the amygdala, and it did the same thing as lesions of the auditory thalamus. It prevented the learning conditioning from taking place. And from there, we were able to work out which parts of the amygdala were involved and how the information flowed through the amygdala, how it came out to different response systems to control behavior with one response, to control the parasympathetic nervous system with another response, the sympathetic nervous system with another output pathway, and then finally the stress hormone system through even another pathway. So the amygdala was kind of a funnel through which all of the environmental information from the senses would be channeled, and then a kind of floodgate with all these responses would go down different rivers to flow out. So that I wrote about all that in The Emotional Brain in 1996. That book was very successful. It's still in print after all these years. How many years has that been? I don't know, like 24.
Yeah, 24. Yeah.
And so that led me to continue doing research, and I wrote another book in 2002 called Synaptic Self, that took the basic ideas about the circuitry and now started asking questions about the plasticity and how all of that connectivity would allow us to put ourselves together as a coherent whole involving implicit or unconscious aspects of who we are as well as the more conscious aspects. And then I didn't write books again until 2015 when I wrote Anxious, which was to pursue one of the threads that had become more important in my work, which was the clinical thread. And the possibility of using all this research about the brain and threat detection and so forth to better understand and possibly suggest how to treat fear and anxiety. So that's where we got to. That's how I got to anxious.
So let's talk about that role of split brains
Sure.
here, because I'm very curious. Like, what did you observe in studying split brains that kind of changed your thinking, if you will?
Yeah. Well, I was a green graduate student at that time. Of just coming into the field. I had no prior real experience in science, or
Mhm.
took no courses in any kind of science in college or high school. Maybe a chemistry course here or there or something, but never was inclined so much towards science. But
That's fascinating. And now you're one of the thought leaders in the field.
life takes you in different directions. So
Yeah, sure.
I was studying actually business administration. I had 2 degrees in business from Louisiana State University.
That sounds familiar.
The process of getting the master's degree, I was taking a course. I was getting interested in kind of like consumer psychology, why consumers buy stuff, and
Mhm.
I was trying to learn more about the mind and psychology and behavior and so forth. And I took this course with a guy who was studying rat brains and and learning and memory. Let me pause for a second. There's some
Mhm.
noise downstairs. Sorry. Nance? I'm recording Zoom video lecture. All right, sorry about that. My wife was doing something down there.
Oh, no worries. I completely understand. The work from home environment changes quite rapidly.
All right, so I'll just pick it up with the rat studies. So I was took a course with this guy who was studying rat brains and memory, and I had no idea you could actually study the brain. So that was like eye-opening. I said, well, can I work in your lab? And he said, sure. And so I worked in his lab a bit. We published a couple of papers together. And I said, I think I want to do this for my career. And so after I finished the master's, I applied to graduate programs, was admitted at the State University of New York at Stony Brook out on Long Island.
So your master's was in business, or was
your marketing? Yeah.
Okay.
And so I ended up out on Long Island at Stony Brook, and met a professor there named Michael Gazzaniga, who had done all this split brain work in California for his PhD 10 years earlier. And he said, sure, you can work in the lab. And so I started testing split brain patients with him. And the kind of standard story with those patients is they have epilepsy. None of the methods or treatments have been working. So they try something else. And the most radical thing that was tried was this kind of splitting of the brain down the middle to prevent information from crossing between the two sides. And that seemed to help medications control the seizures. I'm not sure who first came up with that idea and why they thought that was a good idea, but
yeah,
but
it's kind of along the lines of things like what was sort of when we used to drill into brains and that kind of stuff, right? That it just seems like a very far-fetched idea, but
yeah. But these patients, were desperate. Many of them, teenagers who had been living for years in isolation and having seizures so bad that families would have to hold them down on a mattress, and nothing was helping. And so the families decided, well, let's, this is no life, so let's see if we can have some kind of life for this child if this is what we do. And the general consequences are rather mild in terms of everyday life of the surgery, which is kind of surprising. But anyway, so the brain is split, and the original studies showed that, if you present a stimulus to the left visual field, that goes to the right hemisphere, and the right hemisphere doesn't have language. So The left hemisphere normally would be able to talk about it because information crosses over. But is my left and right crossed? I think it is on the video there, so it doesn't matter. But anyway,
Yeah.
So the information going into the left side of space goes to the right hemisphere. No language there. Left language is in the left hemisphere, so the left hemisphere speaks and comprehends, but the right hemisphere is holding the information that it needs to talk about. So when you ask the patient, what did you see? The patient says, I didn't see anything. But if you then, let's say you had shown a picture of an apple to the left visual field, the patient's left hand connected to the right hemisphere can reach in a bag, fondle several objects and pull the apple out. So the right hemisphere perceived the stimulus and could control the behavior, but it couldn't talk about it. So the big question was, is there like a conscious mind over there in the right hemisphere, or is it just more like a kind of stimulus response machine? And because it couldn't talk, you really couldn't answer that question. But for my dissertation, we were studying a patient that we kind of, in the process, discovered could read in his right hemisphere, even though he could only talk. He could read and talk out of the left, but in the right, he could only read. But that was an opportunity to probe the right hemisphere with kind of verbal questions about who he was and what's going on over there, which had never been possible without any kind of access to a language communication system over there. So we would put information in the left side of his visual world, flash a picture on the screen that would have letters which said, for example, who are you? And so then we had a set of Scrabble letters that we arranged out there, and he would systematically pull out the letters P-A-U-L with his left hand to spell his name, Paul. So here we had a right hemisphere that couldn't talk, could respond to stimuli, but he knew his name. So obviously he had a kind of sense of self over there. And we were able to ask the right hemisphere, what do you want to do when you grow up? And it said it wanted to be a race car driver, spelling out with the Scrabble letters. Meanwhile, the left hemisphere, when you talk to it, said, well, he wanted to be an architect, a draftsman. So, I don't want to make too big a deal out of these little observations because they are just observations. But the suggestion was that in this mind, this brain, we had two conscious realms, right? One side, they both knew who they were. They were both Paul because they had lived and heard that name and knew how to associate it with their self. But one side had a different goal in life than the other side. So that was pretty dramatic. And then the last study I'll describe is one in which we put simultaneously a stimulus on each side of the screen. And on one side was a picture of some snowy setting. This was the kid lived in Vermont, so used to seeing snow. So there was a snow scene in the left side, and on the right side was a picture of a chicken, or a chicken claw, I guess. Yeah. And so the two hemispheres each saw a different picture, and so but each hand then pointed to a different thing. So the left hand connected to the right hemisphere, which saw the snow scene, pointed to a shovel. And the right hand connected to the left hemisphere, which saw a chicken claw, pointed to a chicken. And so why'd you do that? Now you're talking to the left hemisphere because that's the one that's going to respond verbally. And he said, well, I saw a chicken claw, so I pointed to the chicken. That all matches. But you need a shovel to clean out the chicken shed. So the right hemisphere pointed to the shovel because of the snow scene that it saw. But the left hemisphere seeing the person's own behavior, his own behavior. So he's pointing to a shovel, and he had just said, I pointed to the chicken because of the chicken claw. put it together and said, we need a shovel to clean out the chicken shed. He was a country boy. So he generated a narrative on the spot to make his behavior make sense. And so, after we were up in Vermont, we had a trailer that we'd go up with, a testing trailer. And then, so we'd see these patients. Then at night we go stay in a motel somewhere. But then we go to dinner somewhere and have some drinks and go to the bar and have a good time and talk about it. And we said, I think Mike probably said it because I was pretty green. I didn't, just in the field, and all this was new. But Mike said something like, "Well, that's interesting. Maybe that's how that's what goes on all the time. We generate behaviors unconsciously,
Mm-hmm.
and then that's very disturbing if your conscious mind sees it. It's not controlling your behavior. So we had this kind of cognitive dissonance mechanism involved in consciousness that tells a story, a narrative that makes your life make sense. You're doing all these things all the time that you don't know necessarily why you do them. You just know that you do them, and you generate a narrative to account for that. So that was a big deal in terms of my entire career, because I've been talking about that afternoon in Vermont ever since, in terms of how emotions are made. Emotions are cognitive interpretations or narrations of unconscious processes that are controlling our behavior and physiology and so forth. So that's how all the dots came together. But one of the other nights at the bar, Mike said, we were talking about emotions being a possible kind of source of this unconscious information that we need to explain. And so, there's not a lot of research going on in the neuroscience of emotion right now. You ought to consider that. I said, yeah, that's what I want to do. And so that's when I decided to turn to rats, because there were no good studies, no ways to study humans at the time. There was no fMRI or anything like that. You just said occasionally you'd have some interesting patients that come along, but it could be a long wait between this interesting patient and the next one.
All right, so there's a natural question that comes here. If we're all producing this narrative to justify maybe some dissonance or some unconscious actions that we're taking or unconscious things that are happening, can we rewrite the narrative? And I guess part two of that question is something that you mentioned in the book, that we revert to a mean when it comes to anxiety. And so if we revert to a mean, is there any point in trying to address it in the first place?
We revert to a what?
A mean with anxiety. So let's say a person has an average level of anxiety.
Oh, a mean. Okay, yeah, right. So the kind of a set point of anxiety.
Yeah, exactly. So I guess
right.
Maybe if we break it down, part A being, can we rewrite that narrative? And
yeah, so that's what that's why people go to therapy, to rewrite their narrative, or to change the stuff that's making them have a narrative. And I think that I kind of at the end of Anxious, I was sort of coming to I didn't quite make it all the way in terms of my conception of what I wanted to say. But in there, if you read like between the lines and the tea leaves, there's the hint of an approach to therapy, which suggests that you have to first tame the amygdala and prevent it from producing the behavioral responses and the hyperarousal and all of that that gets in the way. And then once you do that, you need to then tame the hippocampus to alter your cognitive memories about your relationship to these kinds of stimuli and situations. And then once you've done that, you've got a brain that's prepared to do talk therapy. Now, I think probably most therapists do those three things, but because they don't necessarily kind of separate them and sequence them that way, that may be why it's not quite as effective as it could be. Because, if you don't get rid of the amygdala and the arousal that it produces, no matter how much you change beliefs and memories and so forth, that arousal will kind of keep them coming back. And so you really got to get that amygdala under control so that the beliefs that you change can stay changed, And then the conscious experiences that result from all of that you talk about in the regular talk therapy need to be consolidated without the disruption that's caused by all this arousal and the reactivation of the memories and all of that. So, I don't know how practical it is to actually pull that off in any kind of situation, except simple phobias. For example, if you have a spider phobic patient, they don't like to do exposure therapy because it's just too stressful to see those spiders. But you can present those spiders subliminally so that they go directly to the amygdala, but the person doesn't know they're there. So you can extinguish the amygdala by repetitive presentation of the spider over and over again. And this is hypothesis, not fact.
Yeah.
And once you've done that, then you can deal with the memories, and then you can do talk therapy. So, I propose that kind of 3-step sequence. I don't think anyone's actually, tested it, but yeah, and I'm not a therapist, so I'm just kind of armchairing all this, but kind of makes sense.
Well, I like it, and I'm just kind of thinking about it in terms of things like common fears, like public speaking or speaking to relatively, I guess, speaking to somebody who would be perceived as superior to you and getting that nerves. Could the same framework work in those situations, or is that just...
Yeah, I think to some extent. Let me say a couple of other things. I lost my train of thought, but so one thing is that if we want to do, you asked about set point. That's what, here, back step, one step. So, the way to think about all this in terms of the brain is that each symptom that a person experiences is a product of a different brain circuit, because it's a different symptom. So, for example, avoidance behavior, which is a classic problem in anxiety. People avoid the situations, hyper avoid situations that are going to trigger anxiety, and so their social life can get compromised by that. And another problem is hyperarousal, where you just feel too wired up and tense all the time. And those two symptoms are products of, different circuits. I mean, they might overlap to some extent, but, for example, the amygdala is involved in controlling freezing behavior and blood pressure and the hormones and all that. So it's kind of like a reactive system. But avoidance is a more active behavior. It's you're choosing to, it's more of a decision that you make about not going somewhere. You have some control over it, but you choose not to do it because you don't want the consequence. So that also involves the amygdala. It also involves another area called the bed nucleus. This would be the nucleus accumbens. It's often associated with reward and positive stuff, but it's also involved in aversive behaviors like avoidance. So it's all very complicated, but the bottom line is to think of symptoms as potentially separate targets in the brain for treatment. So you need to figure out what the symptoms are, and then ask what are the possible brain circuits for each symptom. And even if you don't know the answer to all the brain circuitry, if you treat each symptom as a kind of functional module that has to be changed, then it opens up a different perspective on the thing, rather than like you've got a thing called anxiety and you can change all of that at once. Anxiety is a social construct. It's not a thing, it's something we made up. And so we're not going to find anxiety in the brain. Same thing with fear. We're not going to find a fear circuit in the brain, or an anxiety circuit, or a depression circuit. These are just labels for symptoms. I mean, if you go to a therapist and have depression, you could have depression in 7 or 8 or maybe 100 different ways, depending on which things get checked off on the checklist. So let's say you've got our PTSD there. there may be 100 symptoms of PTSD. I don't know how many. There are a bunch of symptoms of PTSD. And you only need like maybe 3 to count as having PTSD.
Mm-hmm.
You could have, let's say there are 3. Let's say there are 10 symptoms and you need to have 3. Those 10 things can be combined in a lot of different ways to give rise to, quote, PTSD. So it's not a thing. It's just a collection of symptoms that have been kind of socially grouped together by a group of psychiatrists that call it that.
So if I'm to approach this more with like a systematic way and kind of an N of 1 approach, and just sort of look at my own anxieties around, let's say, maybe public speaking or this fear of superior people, quote unquote, superior people, the right way for me to approach it would be to look at some of those symptoms like getting warmer or sweating while public speaking first, right, and associating that with the brain circuit rather than jumping immediately to the take a pill for my ill kind of situations. Do I have that right?
What would jumping to what? What would the
I guess, for lack of a better, jumping like right into benzodiazepines, for instance, and right. I don't know how much you can comment on that, but
yes. Okay. So let's take, some of these physiological symptoms.
Mm-hmm.
We know those are controlled by the autonomic nervous system.
Mm-hmm.
And what we also know is that there is, it's a kind of overstatement, oversimplification that ended up in the scientific literature and probably has been, again, further oversimplified in the lay literature. But the parasympathetic component of the autonomic nervous system has some countervailing force over the sympathetic. So the sympathetic is what drives, kind of the fight, flight,
Mm-hmm.
The parasympathetic can slow it down. And what the ancient yogis figured out without knowing anything about physiology per se, is that controlled breathing exercises activates the parasympathetic system,
Mm-hmm.
and that slows down the effects of the sympathetic. So that's always a really good place to start, because that's something everybody can do. It's just, it's not, you don't have to like jump into full-fledged meditation, just learning how to control your breath and using that. And the problem with these things is they're hardest to implement when you need them the most.
Yeah.
But if you really make an effort to, and I think it has to be a practice of practice of learning to control your breathing so that you can put yourself at ease in an instant or two by going through a few breaths, because you've made that a routine that your body knows how to do.
Mm-hmm.
So once you do that, then you've kind of done the work that some of the work that subliminal stimulation of the amygdala was trying to do, because you just turned off the arousal in a sense.
Mm-hmm.
That's not going to be the whole answer, but maybe we can find other kinds of things like that are helpful for the behavioral responses.
Mm-hmm.
But, if you're less aroused, then you'll freeze less in a sudden situation, because the arousal kind of locks you into the situation, because it
Mm-hmm.
extends over time. So, I think it all starts with kind of good breathing hygiene and being able to use that to slow you down enough to kind of take your perspective and slow your mind down as well as your body, and then make decisions about what can I do next. I work at the level of this kind of behavior and physiology. So
Mm-hmm.
I'm not an expert on telling you what to do to, fix the more complicated stuff. But I do think that, that's one way to change your set point, right? Is to lower the arousal so that the other stuff can be more effectively changed. I mean, that's what therapy is kind of set point adjustment.
Mm-hmm.
And if you can lower your arousal, then therapy can help you make the cognitive changes you need to be less alert to stimuli, and to be more concerned with to be more aware of when you need to breathe and so forth. I don't know. I'm not. This is all BS because I'm just talking out of my hat here.
Oh no, I mean it's fascinating. I think just what is exciting to me about what you said there is that we can kind of reset the set point, if you will, which means that there is hope for people out there who are battling stuff like this.
I mean, the set point idea, when I wrote about it, I think I found out later that others had talked about this. I talked about it in the beginning of Anxious. What I found in myself was that if I'm anxious about something, and for whatever reason, something I've done or the world changed or whatever, that anxiety goes away. It just like made room for another one to come in, right?
Yeah.
So that was the idea that we wherever you are on that set point, you move one out and the next one comes up. And
Gotcha.
if you're not a terribly anxious person, then it's low. But if you're anxious, then you got more of those to fill in the set
You're
point.
always going to search for something to fill in.
Your set point. I mean, I think that's the idea, that we each have a level. And I guess the goal of therapy should be thought of is to modify that where we are on that level, on one goal.
Question for you, Joseph, because there's a lot of emerging, I guess, research and work being done in the world of psychedelics. And if you're willing to pontificate on it, just in terms of how you see psychedelics and their role potentially for things like anxiety.
I haven't followed that, so I don't really know much about it. I think, from what I've seen, there looks like they're promising approaches, but I can't claim any expertise and experience in that.
Okay. Going back to, we can wrap up now with just question on consciousness, because you brought it up earlier. And I know consciousness is one of these emerging fields, and there's still a lot we don't know. Where do you think we are in terms of the continuum of understanding consciousness and perhaps using it as a tool to address anxiety, if you think so?
Well, I think that, one of the big disconnects in the kind of academic approach to things has been, it's been a kind of resurgence of interest in consciousness and through philosophy and cognitive science. But that has totally ignored two things that are near and dear to me. One is memory, and the other is emotion. And so it's a bit mysterious that, like, all of the work on consciousness that gets any kind of academic attention has been on visual perception. How do we see the color red? I mean, okay, that's interesting and important. But what people care about is, how do our experiences come about? What about those memories that, we want them, we love good memories and we hate bad ones. And but where do those experiences come from? How do we remember our childhood, and how do we envision our future as emotional beings? And that just hasn't been a major topic in the science of consciousness. And that's what I've been trying to introduce and bring into that field. It's been a slow process because the field is so focused on visual perception. And so that they think of it as kind of a cute, outside thing, I think. Okay, that's interesting. Someday we'll get to that. But with a couple of philosophers and scientists that I'm close to, Richard Brown, a philosopher, and Hakwon Lau, who's both a philosopher and a cognitive scientist, we've been doing a lot of writing on the nature of consciousness and the role of emotion, especially fear, how consciousness and fear, how fear is a conscious experience and how that comes about and so forth. And what we tried to do is take these standard visual perception models of consciousness and just expand them by saying, okay, we have one mechanism of consciousness in our brain. It's a higher order cognitive processing system involving prefrontal cortex and some other areas of the brain, but let's say prefrontal cortex for the sake of discussion. And what it does in the case of visual perception is it re-represents the visual stimulus, the color red, say, or a picture of an apple, into something that is a higher order state, a higher order representation, that is the state that you become conscious of. Because there's no visual experience that is simply, color in isolation, or even a visual stimulus in isolation. Our experiences are multidimensional, multimodal. So it can't just be visual cortex that's making visual experience. Visual experience is, you're experiencing a scene, so it's very complex. We know that scene perception involves areas like the hippocampus. So you got to integrate, say, visual cortex and object memory in the hippocampus, and also maybe some episodic memory about that scene in the hippocampus as well. That all has to be put together somewhere, and the prefrontal cortex may be where we can put all that together. And so what about emotion? Well, emotion is simply your processing of stimuli and scenes, but with the addition that information that your heart is beating faster, that your palms are sweating, that your muscles are tense, that you have semantic memory that the thing you're looking at is a dangerous thing, and maybe even episodic memories about that kind of danger in your life. And so all of that is, put together as an amalgam in working memory. And out of that comes the experience. I mean, so it's easy to say out of that comes the experience, but every conscious experience up until the last fraction of a second is non-conscious. So what we can study very well scientifically is that all that non-conscious processing that we know, and we can determine in people which of those non-conscious processes the person is experiencing by just asking them, did you see the apple? And we can follow that kind of activity that is generating the content that the report comes from. And when you can't give a report of what it is because you degraded the stimulus or done it, presented subliminally, you get all that processing, but it stops short of prefrontal cortex. So.
Wow. Okay. Joseph, there's a lot we can go into there, but I want to be conscious. That's almost another episode on follow-up questions.
Sure, let's do another one.
I want to be cognizant of your time, but thank you so much for taking the time today to spend it with me and just answer a few questions. But again, would love to have you back for a round 2. But where can people find out more about you, your work, all of your books?
Well, I think the easiest place is my personal website, which is joseph-ledoux.com, and everything is there in one way or another, including my music career, such as maybe that's glorifying. It's not a career. My music sideline. I write music sometimes that go with books, and all the amygdaloid songs are about mind and brain and mental disorders. I have a few side projects there with my colleague and friend Colin Dempsey, a great guitar player and singer, plays the bass in the amygdaloids. Daniela Schiller, who's the drummer of the amygdaloids, is also a very well-respected cognitive neuroscientist. Tyler Vogt, the biologist in the band, is a guitar player and an environmental scientist. So, my books are all there, my music, the press about all of this stuff, whatever. Blogs, whole 9 yards.
Well, we're going to link to all of it in the show notes. And Joseph, thank you again for being so generous with your time. This is a fantastic conversation, and looking forward to the next one.
Very nice talking to you.
To all the superhumans listening out there, have an absolutely epic